I want to just welcome everybody and thank you for your time. And we're going to do some introductions of the hosts of the evening before we start into our main content. My name is Natalie Hicken and I'm a registered midwife with Roundhouse Midwives here in Victoria. I've been a midwife since 2008 and home birth is one of my interests. It's been different and definitely something that's kept us on our toes with COVID, and I'm sure we're going to have a lot of questions about that this evening, but we're hoping to cover both COVID related things and just in general what an out of hospital birth with a registered midwife looks like. So yeah, feel free to type your questions into the chat if you think of them as we go along, and we'll keep an eye out. So I can see everybody's screen, so maybe Christy, do you want to introduce yourself next?
Sure. Hi, everyone. My name is Christy Dremel, and I am currently locuming with Roundhouse Midwives for Astrid, who's on parental leave. And I've been a midwife for about 7.5 years now, and I'm happy to be here tonight. This is the second time we've done this recently. I guess pre-COVID was our first one in a while, and then of course COVID happened. We had to take a break, and hoping to address a lot of your questions because home birth has been a little bit more on the forefront with COVID. So looking forward to chatting with you all and answering any questions you have.
Heidi, can you unmute?
Hi, everyone. My name is Heidi McNee. I'm also a registered midwife in this community. I'm also a locum midwife, which means I can I pop around to different clinics and fill in gaps where there's a need. I'm really passionate about home birth. It's something that I love very much. And I think maybe you've all sort of heard the chatter in the community and around the province that there definitely has been an increased interest in home birth since COVID sort of made itself known. And so, yeah, this is definitely something that we're doing a lot of. And like Christy and Natalie said, I'm sure you have lots of questions, and yeah, I feel like the information that's about to come is really valuable. So I hope you enjoy.
I also see Sarah.
Hi everyone, welcome to the webinar. I'm Sarah. I'm the 4th year midwifery student that is placed at Roundhouse, and I also worked with Christy in my 3rd year as well. So 4th and final year. I was a doula for 10 years before starting midwifery school, so did teach a lot of home birth info sessions from a doula perspective with midwives as well. So I am happy to be here, and yeah, glad everybody's here to learn more.
Thank you. We also are really happy to be co-hosting with Vita Doula's group. So Jay, do you want to go ahead and start?
Sure. My name is Jay Duncan. I am one of the members of Vita Doulas, this beautiful collective that I've been working with for the last probably 6 years. I am a childbirth educator, a Lamaze certified childbirth educator, and a birth doula, and have been doing so in the Victoria area for about 15 years now. And I'm just really happy to co-host this lovely home birth workshop with everybody. Thanks.
And then we've got Shay.
Hey everyone, I am Shay Long. I am a birth doula with Vita as well as a birth photographer. I've been working in Victoria for 5 years now doing that, and I'm super excited to share with you a bunch of photos from home births of families in Victoria to help you sort of see what home birth kind of will look like.
That's great. Barb?
Hi, everybody. Well, I'm so glad to see so many people here interested in home birth. It's one of my favorite things to do. I've been a birth and postpartum doula now for 12 years. I've worked with almost all of these midwives, and I am just honored to be amongst this group. I like to focus a little bit on the postpartum care, but I'm willing to answer any and all questions.
Great. And then we've got another Sarah from Vita with us too.
Hi everyone, I'm Sarah. I'm a birth and postpartum doula and also a breastfeeding counselor. And yeah, it's really exciting to see the turnout and the interest in home birth. And I think this is great. So excited to be here. Thanks.
Great. We also have Laura, but she's having some troubles with her mic, I think. So we'll just say hello to her in our minds and our hearts. One of the advantages of doing this on a webinar platform is we can share electronic resources a little bit easier. And so one of the things that we wanted to share was a video that's put out by the Association of Ontario Midwives about giving birth at home. So we're going to go ahead and share that. You should be able to see my screen now.
I'm Rebecca Tababarang, and I'm a mom, a researcher, and a magazine publisher. When I found out I was pregnant, I felt so excited, nervous, happy. There were so many choices to make. I'd already made a big one. I wanted a midwife to provide my care. Midwives are covered by the healthcare system, so there is no cost to have a midwife in Ontario. And appointments are typically at least a half an hour, so I'd never feel rushed. I love the idea of learning from these experts in pregnancy and birth. The first thing I learned was a surprise. I had assumed my midwife would deliver my baby in a hospital, but she said that for a healthy, low-risk pregnancy like mine, I could consider giving birth at home. It's just as safe for my baby as giving birth in a hospital and has proven health benefits, including fewer complications and medical procedures, such as lower rate of C-sections. I wanted to know more, so I asked for the evidence. I learned that midwives are regulated healthcare professionals just like doctors. Since 1994, Ontario midwives have delivered more than 225,000 babies, about 49,000 at home. There's solid evidence on the health outcomes of babies delivered by midwives at home and in hospital. For example, a major study reported in the Canadian Medical Association Journal in 2015 looked at 18,000 planned home births with midwives in Ontario and compared these to hospital deliveries by the same midwives. The study found that the safety for babies was the same, whether delivered at home or in the hospital. This is even true for the risk of losing a baby. It is extremely rare in Ontario, and both home and hospital birth are equally safe. But it turns out that planning a home birth isn't just safe for my baby, it has health benefits for me too. The evidence shows that there's a lower rate of medical interventions for those who even just plan to have a home birth, as compared to those who plan to give birth in a hospital. For example, pregnant people who planned a home birth were 30% less likely to have a C-section, had lower rates of episiotomies, and lower use of vacuum or forceps to assist with delivery. I discussed all of this with my midwives. They explained that the reason home birth is just as safe is that midwives are highly trained clinicians. They have 4 years of university training, followed by a year-long mentorship with an experienced midwife. And they're fully accredited and well integrated as part of the medical staff at the hospitals in which they work. There are usually 2 midwives attending at either a hospital or home birth. And they're specifically trained to attend home births, plus how to identify emergencies and plan accordingly. They follow guidelines about when it's best to plan a hospital birth and when the move from home to hospital is the best practice. Finally, midwives bring the same equipment to a home birth that they would use to deal with an emergency in a hospital, including oxygen, resuscitation equipment, and medication to treat postpartum bleeding. All of this made me think about what was really important to me. Since a home or hospital birth is equally safe for my baby, I made an informed choice. I decided to give birth at home, knowing my baby would be just as safe as in the hospital, believing in my decisions and capabilities, and trusting my midwives to support me every step of the way. I'm really glad I did. Having a home birth was one of the most powerful and positive experiences in my life. If your pregnancy is healthy, consider a home birth. It's a safe and healthy choice.
So a bit of an intro there, and we'll cover a lot more this evening about what that looks like. And that video is from Ontario. I do like it because it is a Canadian resource, but in British Columbia, we practice quite similarly to the Ontario midwives. So one of the things that we wanted to go over is what type of equipment that we bring, because we often get a lot of questions about what we do and don't do at home. And so we've put together our own little tour of what our home birth equipment looks like. And then after that, we're gonna go over together what reasons we may choose to transfer to the hospital or recommend transferring, a lot of that being based on equipment that we don't have with us at a home birth. So I'm gonna screen share that again.
One of the options we offer here at Roundhouse Midwives is to have your baby in what we call our birth cottage. This video is for a virtual tour of the cottage, so let's go inside. Here we are inside the cottage. This is how it looks when nothing's been set up, just a regular room. This is an important distinction so that people know that this is not a birth center. It is really just a room that you can rent to have your baby in, and it's the responsibility of the midwives to bring in their medical equipment just like at any other home birth. We'd like to show you what a typical home birth equipment setup is like. In this case, we've got it laid out much more obviously than we would in person, but everything is on display so that we can give a much more in-depth tour. Here we have some PPE, which the midwives will be using at the actual delivery, including mask, gowning, and eye coverage. We carry sterile and non-sterile gloves depending on the procedure that we need to do. For monitoring fetal heart rate, we follow SOGC guidelines for what we call intermittent auscultation. This means using a Doppler with ultrasound gel to listen to the fetal heart rate about every 15 to 30 minutes and more frequently during the pushing phase. We have maternal blood pressure cuff and stethoscope to be monitoring vital signs, as well as thermometer. Here we have a medication kit. Everyone's looks a little bit different, but we are all required to carry the same medications. We have hemorrhage medications, oxytocin, ergonavine, and misoprostol, as well as a variety of sizes of syringes for injecting medication. Here's some of the equipment for the actual delivery. We've got instruments that are provided to us by the hospital, which is where we also drop them off for reprocessing. So we carry birth equipment, instruments. We also carry suturing instruments, suture material, and injectable lidocaine. This medication right here is the only pharmacological form of pain relief that we do offer at a out-of-hospital delivery. We also carry episiotomy scissors, which is not done routinely, but we have those in the event of an emergency. One of the things that a midwife can do at the home for various reasons would be to put a catheter in the bladder. We also carry catheterization equipment. In an emergency, or sometimes in the event that we are running antibiotics at home, in the case of group B strep positive, we will carry IV equipment and IV medication, usually penicillin, that we are able to run at the person's home. Midwives also carry oxygen tanks in the event that we need to provide supplemental oxygen to the newborn. If they're not breathing very well at birth, then we would connect that to our artificial bag and mask here, and we would breathe for them until they are able to take over respirations on their own. Here we have a typical setup for examination of the newborn. We have a scale that we can weigh the baby with, neonatal or pediatric size stethoscope, measuring tape, injectable vitamin K for that first dose after the birth, and we also carry an oxygen saturation probe. This is an ophthalmoscope, which is used to check something called the red eye reflex. If the newborn is requiring a more extensive resuscitation, and while we are awaiting ambulance transportation to the hospital, we are trained as midwives yearly in a program called Neonatal Resuscitation Program, so that we can initiate further resuscitation steps while we're awaiting the ability to get baby extra help in the hospital. This includes a suction device and training in how to intubate the baby, to put in an artificial airway. We also have training on how to place an umbilical line catheter so that we can give the baby IV epinephrine. These pieces of equipment are quite rare that we would use them, but we do carry them with us to all deliveries in the event that we do have an emergency that is requiring extensive resuscitation.
Going to hand it over to our student midwife, Sarah, and she's going to talk to us a little bit about home birth.
Great. Hi, everybody. This is my first Zoom version of the home birth session, so it's different when I can't see all your faces. And but if you have any questions as I'm talking, please, I can see the chat there as well. So please make sure that you say something, because I think that the safety of home birth and reasons to transfer are one of the hot topics, I guess, the big concerns for parents who are considering having their baby at home for their first birth. So a few things to consider. That video is great. It gives a really good overview from the Ontario Midwives Association, really the core components of what makes home birth safe. And as midwives and as care professionals, evidence-based practice is really the foundation of what we do. And we wouldn't offer home birth as an option if we couldn't prove and continue to prove that it is a safe option. And there are a few ways that we continue to make sure that home birth is safe and make sure that it's something that we can offer in the community, because we are regulated professionals and we have obligations and standards of practice to make it so. One of those things is screening. And when you come into care, into midwifery care, we are specialists in healthy, normal pregnancy that sometimes may deviate from that normal course. But what we can do is for people who have pregnancies that are remaining healthy throughout, and babies are remaining healthy as well, we can offer home birth as a safe option. So it isn't a one-time, let's have a conversation about having an out-of-hospital birth. It's a continual conversation throughout your pregnancy where we reassess, is home birth a great option for you? Is your body remaining healthy? Is your baby remaining healthy as well? Will we have all of the things that we need at home to be able to offer you a safe birth? Versus being at the hospital. So some of those things are, if you were to develop a significantly high blood pressure, well, that might actually screen you out of having a home birth, because it would no longer be a safe option, because we wouldn't have the tools to be able to support you in a safe way at home. So the number one thing is the person healthy? Is out of hospital a safe option for them? The other thing that we consider is, do we have everything that we need at the home? And are we within a safe distance from additional support if we need it? So that's another thing that we consider in terms of home birth. Now, in this community, it's very safe for people who are low risk meaning healthy, to birth at home, because we have a high level of care available to us that's quite close. Even if you were to be in Souk, it would still be a safe option. It's just a different screening process as a care provider, keeping in mind how close you are to a higher level of care if we needed it. So the things that they think about in terms of safety of home birth and it being equal in both options, one of those things is, where does the person who's giving birth feel safest? What gives them the most oxytocin? So what makes them feel safe and secure in the place that they're giving birth? And that's sort of the first thing that you should think about when you're having that consideration is, where do I feel like is the safest place for me to have my baby? That's number one. Number two, are my care providers trained And do they specialize in home birth? Well, yes, of course, because in British Columbia, regulated midwives are highly trained in supporting home birth and birth outside of the hospital. And we have much more strict standards for neonatal resuscitation and emergency skills as any other type of maternity care provider, because we offer out of hospital birth. And then, so I've talked a little bit about the screening process. And then about actually being at the home birth. So when you go into labor, or when you feel like you're having those sort of starting to have active labor, that's when we would come and stay with you. And at that point, that initial point, that's when we start thinking about, let's do a full assessment again. Is this the best place for you to have your baby? And that includes listening to the baby, taking your vital signs, seeing how well you're coping. And if you're really doing well at home, and if that continues to be the same throughout your labor. And the number one reason to transfer into the hospital isn't actually an emergency, or even close to being an emergency. It's actually for something we call therapeutic rest. And that's because moms have had, or birthers have had, a long labor, and they need a bit of help to be able to get some rest, which is usually an epidural or some other kind of pharmacological pain relief, to be able to get that rest so that you can withstand the rest of the marathon that you have already geared up to run. Doulas are very good at helping you get through and manage and cope and succeed in that early labor part, really trying to conserve all of that energy, so when the active labor starts, then you're like ready and can withstand that marathon. Really, it's like training for a marathon when you have a baby. So we do continual assessments, and we have a guideline and protocols, of course, for when we would need to transfer out to the hospital. And our sort of outlook on that is always transfer early. So we're very good at recognizing when things are, because we know normal so well, we're very good at recognizing when things are not quite normal. And it's our obligation, and it's part of our standard of care to transfer to a hospital when we feel like things might need extra help. And so often when we transfer to a hospital, we don't end up actually needing additional hands on deck, but it's good that we transferred, because we don't want to be at home if that scenario that we thought might happen happens. So something like that might be, we're listening to the baby's heart rate and we hear a bit of a dip. And we're thinking, is this normal in the full clinical picture of what's happening, with contractions, without contractions, in the position that the mom is in? Is she very dehydrated? We think about all the different things that are going on. We have a sort of protocol that we follow to try to resolve that heart rate. Your baby's not in any immediate distress. We listen again. Is that heart rate the same? Well, we need to transfer in and see if maybe we need to talk to an obstetrician, or maybe we need to talk to a pediatrician, or maybe have a pediatrician on board. So one of the things we look at is how the baby's doing. Another thing that we look at is how you're doing, how the birther is doing throughout the labor. And some of that is clinical. So have you developed a fever that we need to maybe go in for and manage that? Your waters break and there's some meconium in the fluid, where that's baby's first poo. Now that can mean that the baby is just ready to be born, is for over 41 weeks and is ready. It could also mean that baby's a little bit stressed out. And so we transfer in so that we can make sure that pediatrics is there at the delivery to do that initial assessment after they're born. So keeping a good eye on how baby is doing, so the well-being of the baby, keeping a good eye on the well-being of yourself, and that's both not just the clinical component, but how you're doing in your head and heart, and is home birth still what you want? and maintaining that informed choice process. And then, of course, after you have your baby, we pay attention to your bleeding as well. And in all of those scenarios, what makes midwives great attendants and makes home birth safe is that we're able to manage any emergency that happens at home. Any emergency that may happen in labor, we have the same tools and the same protocols in the home and the hospital. So if an emergency happened at the hospital, we would use the same medications, we would use the same clinical techniques, we would use the same ways to assess your well-being, and we would use the same thing to call for help. At a home birth with a delivery, there's always 2 midwives. If we needed to transfer out, we're calling for help. We're calling the EMS. We're also calling any additional people that we need to meet on the other end so that there's no delay in your care. So when we talk about the outcomes being very similar for home and hospital, and what makes it safe is because we have access to the supports and the tools and everything that we need in the same place. And then the last thing I wanted to mention is those acute, I often hear, and I've heard the same question over the last 14 years is, but what about those really, really bad outcomes? Like what if, and those are those really big red flags that every parent is worried about. And that could be, one of the big things is what if the baby dies? And that's a real big question that we have. Does it make a difference where I had my baby? And the evidence shows that it doesn't, because when those things happen, they're often unexplained, or they happen very, very rarely. Of course, this is something that happens, but there's no difference in the management, how that could have unfolded. So if that happened at home versus happening at hospital, there isn't a difference in what the management could have been, regardless of where you give birth. So that was one thing that I always felt was really reassuring to me when I was having a home birth, is that in those moments where the worst of the worst could happen, does it make a difference where I'm giving birth? And the answer is no. So long as I have very skilled attendants and I live in a good proximity to additional helps, when little yellow flags or little pink flags come up. It doesn't, that was reassuring to me. So I think that covers most of sort of the safety and the reasons to transfer. I mean, there are other reasons to transfer, but those were just really the majority of the things that we would transfer in for. And I don't know if anybody has any questions initially, or if we leave those to the end.
Yeah, I think we'll keep going because we've got a lot that we want to cover. I'm going to hand it over to Christy. She's going to talk about changes to home birth with COVID precautions and what we're doing differently as midwives.
All right. And when Shay does her slideshow, you're going to see pictures of some of the midwives in the community in the PPE. So I'll probably interrupt and expand a little bit more there as well. So I guess to start off, one of the things that we're trying to kind of mimic is our exposure to you and your family, and your exposure to us. And so in terms of Victoria General Hospital and their 2 support person policy, we're trying to do that at home as well. So that's often a partner and then another support person. Now you might wonder, what am I going to do with my other kids? We would ask that you could potentially have another support person, but they're just responsible for taking care of the kids, and in another room. And of course, it would be fine for them to come in for the birth, or just after the birth. But, you know, ideally what we're trying to accomplish is to be able to keep that 2-meter distance as much as possible. And of course, the more people that are in the mix, the less we can do that. So we realize it's a bit of an awkward ask because it's your home, right? But we're not part of your bubble. And so we have to keep that in mind, because we want to keep on working. We want to be at your birth, but we want to be at other people's births as well. So we have to protect ourselves. And also, we're in the community, right? So again, we need to protect ourselves, or protect you from us, which is why we're wearing the full PPE now. And so with the, we've stepped things up recently. I think it was November 19th or so when the new public health orders from the lovely Bonnie Henry, you know, were kind of stepped up again. And so we've stepped up as well. So we're also asking for folks to wear masks. So we're going to be wearing masks, and we would like your support people to wear masks as well. So the laboring person doesn't have to wear a mask, but the other people who are in the room with us, we would like you to, or we would very much like you to. Now, in terms of the laboring person wearing a mask, this is the same at the hospital. Let's say you were to develop a fever. You know, often fevers develop or not often, but sometimes they develop in labor for a variety of reasons. Usually it has to do with an epidural or a long labor or something like that, something that generally wouldn't happen at home. However, if it does happen at home, we'll be talking to you about transferring in, and we'll put you in a mask in the meantime. And we'll ask you to wear a medical mask as well. So if you have some, that's great. If you don't, and we have some, then we will provide them to you. But medical masks, you know, we sometimes have a hard time getting our hands on them. So if we have a good supply of them, then we'll be handing them out. Now, water birth is, you know, something that we talk about a lot as well, especially in COVID. So we know that with this virus, people who test positive for it, it is in the poop. And when you are pushing out a baby, you'll often have a bowel movement as well during the pushing stage. And that's really normal for that to happen. Now, if you can imagine being in water when that's happening, then you've got the feces really floating around. And normally in a home birth, we get pretty wet at home births. You know, we try our best not to, but it just doesn't seem to work very well for us. You know, so now if you can imagine, we're in this full PPE, we've got to listen to the heart rate and stick our arm in up to here, you know, to get to your belly. You know, then we're kind of sopping wet in our PPE, and then there's this potentially poop floating around that, you know, that could potentially be carrying the virus. So, you know, it's unlikely. If we knew you were COVID positive, we would be going to the hospital, or if you were symptomatic. However, there's some research now, I think they did this on some of the cruise ships, that about 80% of folks who test positive are asymptomatic. So, so there is this possibility that there's a lot of us walking around that are positive and we have no idea. And so this is to mitigate the risk to your midwives and also to your baby. So we're kind of putting a hold on water births right now. However, if you're really wanting to be in the water, you can still labor in the water. But we would ask you to, when we're listening to the heart rate, which is every 15 to 30 minutes, we'd ask you to kind of stand up or get your belly out so we can listen to the heartbeat without having to put our arms in up to here. And also to birth out of the water. So just kind of stepping out or whatever it is, but just not in the water. Now, the last thing, of course, is just screening for COVID symptoms. So we should be asking you, at your appointments, before home visits, and before your birth, whether it's at home or the hospital, if you have any symptoms. So, and if you answer yes to any of the questions, like a fever, a new cough, traveling outside of the country, anything like that, you could potentially be positive, then we would ask to go to the hospital to have the baby. So I think that is generally about it in terms of COVID precautions.
Yeah, and like you said, we'll do the slideshow and probably get to more. So I thought next we would hand it over to the Vita Doulas group, and they can talk about what working with a doula is looking like during the pandemic.
Thank you. I think there's a question here about, do you provide the water tub?
Oh, so there are places that you can rent the tub in town, including Roundhouse Midwife.
Yep.
There's several services that you have to organize the water birth tub in advance.
Yep. And Shay on our Vita group, she is now renting tubs now too. So definitely check her out.
Oh, there she goes with her link.
She's quick. She's
Great.
quick. So yeah, I'll just talk a little bit about what doulas do and what the role doulas have in regards to a home birth. In a nutshell, what doulas do is they provide emotional and informational and physical support during a birth. Big difference between the midwife and the doctor or midwife, big difference between the doula rather than the doctor or midwife is that we don't have the obstetrical training. So we certainly cannot diagnose anything. We cannot administer any kind of medication. And everything that if you come to us with some sort of a medical issue, we are always going to suggest that you talk to your midwife or your doc for sure. The big piece of doula care is that we offer continuous labor support, which means we're usually there well before you are in, really good active labor, but we definitely stay 2 to 3 hours after the birth. One of the lovely things that doulas do is that we will be with you in your early labor phase. So we usually will come to your home in the early labor phase, whereas you may not see your midwife until you're in really good active labor. And the benefit of that is that what the doula can do is, number one, reassure you that it's not time to call the midwife yet, or it's not time to run off to the hospital yet. And by doing that, we would help you, time your contractions, offer you physical and emotional support to help you cope through the process. It was mentioned before, I think by Sarah too, is that one of the reasons why some transfers happen during home birth is because the clients are really tired and very exhausted. And what a doula can do is, because we're seeing you there so early in your labor, we can suggest ways to help you rest and to help you cope and to help you get some sleep, even in the early labor period. So it's not unusual for some doulas actually to spend the night, quite honestly, on your couch. And that sometimes gives you a little bit of reassurance that at least the doula is there. And so some clients actually can relax enough so that they can actually go to sleep. And it's not unusual for me to come into a home at 11 or midnight and everybody goes to sleep and nothing happens until 9 a.m., 10 a.m. in the morning, which is fantastic. You've got all that beautiful sleep and it's time to now get that energy working in regards to your active labor. So it's fantastic. We take the guessing game sometimes out of the labor, so we can actually help with the timing of contractions. And because we've been to so many births and we have an idea of what emotionally what different stages of labor is, we can determine if you are in active labor and when is a good time to call your midwife. So it kind of takes the guessing game out of you as well as your partner. So your partner and you can just really connect with that labor and not have to worry about the theoretical stuff. And that's what sometimes the doulas will be there to help you with. So it helps you not maybe call anybody too soon. Sometimes it gets a little discouraging when you feel that, oh my God, yes, it's time to call that midwife. The midwife comes over, checks you, and you're 2 centimeters. And then she goes away and everybody's a bit distressed and, oh my God, I think she should stay. And so we're trying to avoid that by really helping you get into really good active labor so that when that midwife does come over to your home, it's time to go. It's time to rock and roll and she's not leaving. So that helps a lot. Another great reason for having a doula at your home birth is because there is no, other than when you're getting sutured after your labor, there really isn't any pharmacological help at home. Basically, your home is your epidural. And so what a doula can do, and this is evidence-based, that actually by having a doula attend your birth, you can expect to experience a 10% decrease in the use of pain medication. So that's really, really helpful when you're planning to have a home birth. Because there are, it helps. What we can do is obviously offer that emotional and that physical support and actually help you cope with that, with the process, so that hopefully you've rested, we've helped you rest so that the need for pharmacological support is reduced. It doesn't necessarily mean you won't need it, because there's going to be those 45-hour or 50-hour bursts where you need some help. And so that's something that we would help you do. In case of a transfer, we obviously, if it's a home to a hospital, we will accompany you. So I always tell my clients, either I can ride in the car with you, or I just ride behind you, okay? And so basically, as soon as when the midwives arrive, we keep doing what we need to do. The midwives have their obstetrical protocols, and they're going to be checking your baby's heartbeat. They're going to be checking your temperature and your blood pressure. And we're basically just going to do what we need to do to help this baby arrive safely. So whether that's helping you with physical positions, rubbing your back, offering verbal instruction and support, and also helping your partner cope with the whole process too. I think it's really important that sometimes people need to know that things that are happening in that birth are normal. So her moaning is normal. Her wanting to get on their hands and knees is normal. Her possibility to maybe vomit is normal too. And so that all helps to actually settle everybody in that room so that nobody's panicking in regards to the behavior that maybe the birth giver is displaying. After the birth, we tend to stay about 2 to 3 hours after the birth to make sure that the birth giver has something to eat, which is awesome. So we will have a little discussion, probably 1 to 2 months before the birth happens, and that's part of the program that doulas have, is that we do meet with you prenatally, and we talk a lot about your birth plan and what you're hoping to achieve, and what you're hoping the doula themselves can help you with. So by the time you are in labor, we know you quite well, and we know what your needs are. And so one of those conversations may be, let's make sure that there's a pot of soup on the stove, or some stew, or let's cut up some fruit and make sure that mom has something to eat, not only after, but even during the labor. Because if there is no medication or there is no intervention being done, that means that you can eat during that labor, which is really, really important to sustain energy. And so we'll talk a lot about different types of foods and things that we can do. We are all very familiar with pools now, and so usually after the birth, as a doula, I can help empty out the pool. It's really, really important, because a lot of people, when they come to me, they say, oh my God, there's going to be so much mess. I don't want it in my house. There's going to be blood. I'm going to have to clean up everything. You do not have to clean up a thing. When you have that baby, by the time mama goes into shower, the midwives and the doulas are like little elves, and we're cleaning the bed and we're making the bed up for you. So by the time sometimes the birth giver gets out of the shower, this beautiful made fresh bed is all ready for you and your baby. So it's really quite lovely. And midwives and doulas will actually clean up everything that needs to be cleaned up. I will, basically just help to freshen up your bathroom, maybe, clean up some dishes in the kitchen, all that kind of stuff. So it's not your responsibility to clean up anything in that birth. And so I just really want to make that, because that tends to be a huge issue that a lot of people have, is the mess, the possible mess. And we have lots of pads and all that kind of stuff that your midwives are going to suggest that you have in your home birth kit that will help to minimize any mess. And there's not a lot of mess. There's really not that much mess. So we will take care of all of that. And then part of the VITA or part of the doula plan is also to provide postnatal visits. So usually we try to see you 24 hours after the birth, and which is really more beneficial if you're having a home birth, because right now with COVID, doulas are not allowed in the mom and babe unit. So the next time usually we see you if you're having a hospital birth is when you do come home. So if you're having your baby at home, we could still now offer our 24-hour postpartum visit to you. And then usually we see you a couple of times within the first couple of weeks of your baby's birth. All doulas are expected and do wear masks, and we provide masks for ourselves within the birth, and we would be wearing those masks throughout the entire labor. Okay, I think there are some information that we can give you in regards to finding a doula. Obviously, there is Vita Doula. There's 6 of us, and we all act as doulas, breastfeeding counselors, postpartum doulas. So that's a really good start to see if you would want to, if you're interested in a doula, is to take a look and look at our website, look at our profiles, see who resonates with you, because it's a very emotional, it's an emotional choice. This person is going to be with you for the most vulnerable time in your life. And you better make sure that this is a person that you really feel comfortable with. To seek out other doulas in the community, there is always our Doulas of Victoria website that pretty well hosts about 35 to 40 working doulas in the Victoria area. And that is another opportunity for you to seek doulas. And the website is fantastic. They give you an idea of how often, how long people have been a doula for. Are there any other modalities that these doulas do? Are they, massage therapists, Reiki people, all that kind of stuff. So yeah, we always suggest that you take a look at the profiles, maybe have an interview with 2 or 3 of us. It's called a meet and greet, which are no obligation, but it's an opportunity for you to ask as many questions you want in regards to your doula to see who you would eventually love to work with. So hopefully we'll be hearing from some of you. Thank you very much.
Do you want to just nod to the Nesting Doula Collective and what's going on there right now?
Most definitely. I am now a member of Nesting Doula Collective, which is a collective of BIPOC doulas, and our mandate is actually to offer doula support to BIPOC members. And it is that we are funded so that people who come to Nesting Doulas we are funded so that you do receive low to no cost as far as a doula is concerned. So we're really kind of mandated to work with BIPOC and marginalized individuals in the Victoria area. So that is something that I'm very excited about, and obviously very near and dear to our heart, because it's giving racialized birth givers an opportunity to work with a doula who is also similar to their either race, culture, or spiritual values. So thank you very much, Natalie, for mentioning that.
Yeah, thanks. You guys are working on a big fundraiser right now that we're getting
sure
ready to share on social media. It's pretty awesome.
Great.
Yeah, thanks. Okay, so I'm not sure if any of your Vita colleagues wanted to weigh in, but Vitas are still working in the home and hospital, or doulas are, and doing postpartum and prenatal support in person.
Yep. And so far we are, as far as we know, still allowed to practice in the hospital as well, because that's only been a couple of months where they were only allowed one in the hospital, only allowed one support person, and now that has opened up within the last month and a half to 2 months. So now a birther is allowed to support people at their birth, and that could obviously include a doula. So far that protocol is still in place.
Great.
If you like, I could just touch on postpartum support.
Please.
I know myself and some of the other doulas are offering both virtual and in-person postpartum support, depending on what the client's needs are. And I know when I've done in-person support, I go in and mask and lots of hand washing and all that kind of protective equipment. But yeah, for the people that do still want some sort of support, there is the option of virtual support, and you can always talk to whoever you're interested in working with and figure out a plan for that.
That's great. Thank you, Sarah. Did anybody have any questions for the VITA group? You can wave at us or unmute yourself, and otherwise we'll keep going. Great. We've asked a few people to come as a guest speaker and share their experience with home birth. I see Ali is here. I wondered if Ali, did you want to turn on your camera and come on and share your story with us?
Hi, can you hear me?
Hello.
Hi. So yeah, my name is Ali, and I don't see anybody's faces, but I'm sure people can. I hope people can hear and see me.
We can see you.
I think I was one of the first clients of the Roundhouse midwives when they moved to the farm, and I gave the birth to my girls at the Roundhouse birth cottage. And honestly, it's one of the two best decisions I've made in my life, to be quite honest. I think one of the people who just talked before me said it's all about where you feel the safest. And I think that's why I chose an out of the hospital birth in the first place, was because when I saw the hospital, I was just so shocked by the gray walls and how medically involved it looked. And I was like, well, pregnancy is a natural thing. It's not an illness, it's not a disease. Why should I feel like I'm being treated for something when I'm giving a birth? And also the bed, this is maybe just very childish, or I don't know, but it was like, it felt so narrow and so high. And I was like, if I am to give birth at this thing that I don't feel safe at, how am I supposed to like dilate and open and just like bring my first baby into this gray walls with so many like tubes and equipment like beside me? And I was just like, no, this is not happening, I'm sorry. And my husband was away at the time. He was gone for probably like half of my first pregnancy. And I was with Astrid, Fritzsche, and Lauren McCaddy, I think is her last name. And I remember going into that appointment with Astrid, and I was talking to her about my options. And I was very new to Victoria then. 2015 was when I got pregnant. It was my also first year as a resident in Victoria. So I didn't know anybody. Like people around me were not just, pregnant because I was pregnant, and I didn't know who I could go to for questions. So like the midwives were my go-to person. They made me feel very safe. And she talked about home birth, and I was like, well, what's wrong with like a hospital birth? And she said, well, statistically, you need, or like what did you say? You need less interventions, or like the chance of interventions being needed is less when you're comfortable at home. And we live in a squam mold. And I thought, well, if it's at rush hour, if I start my labor at 4 p.m., I don't want to be stuck on the highway going to the hospital. And then there was a birth cottage. And when I looked at it, it looked like somebody's bedroom. And I was like, it's kind of weird too. But then my husband came back, he looked at the cottage. He said, well, wherever you feel most comfortable. And before this meeting, I asked him, were you like always supportive of that decision, or did you just kind of go with it because I kind of make the decision and he just goes with it, just how we are? He said, well, it's your body. It's your body. Why should I make a decision about your body, if that makes sense? So yeah, like he was always supportive of that. His mother was not, because she's a nurse. So we ended up not telling her at all. We thought, well, if we have a good birth at the cottage, she would not be able to say anything. If I do need to transfer, well, that's what we tell her. Sorry. And then I was talking to some other moms, and I said, what are the questions that I should ask my midwife before the birth starts, or like before even the due date comes? And I talked to, I think it was Lauren. No, it was Astrid again. I asked her, what equipment do you bring? And she told me there's a huge list of everything they bring in their bag. And I was like, wow, what's the difference? Might as well be a hospital. There's so much stuff that you can throw in if something goes wrong. I think Natalie also asked me to say something about what was difficult and what I liked about the home birth. I think what I really liked was that I felt in control. I felt like there was no rush for me to, I don't know, go faster or go slower or whatever. I was kind of the star of the show, and everyone looked at me and everyone cared about me, and that's like the main thing. In the hospital, I felt sick, right? The only other reason I was in the hospital before that is my mom's cancer, so I didn't want that kind of be around me. At the birth cottage, it wasn't a farm; it was close to the hospital, so that kind of gave me the peace of mind. But it also felt safe. Like, it was really, really safe. The bathroom was right there. The little kitchenette was right there. The bed was huge. The floor was nice, and I think it was hard floor, and it was nice and it felt warm. It was like tile or something else. And I actually started my birth at the gazebo. I was outside. It was the middle of summer. It was beautiful. Astrid kind of wanted me to give birth there. I was like, that's not happening. I need light. And then for my second birth, it was a no-brainer. I chose the cottage as well. And I wanted to do pool birth because I want to try it. And since we only really wanted 2 kids, I was like, well, if not now, I'll probably want to try it again. And Asta told me, you won't have time. I came there, I think 2 hours later, Natalie came in and I gave the birth. Yeah. I also really like that at home birth, you get 2 midwives. I think that's really cool because when you give the birth to the baby, the midwife, one of them takes the baby and does the measurements and whatnot. And the second midwife kind of stays with you and supports you through those first few moments when you realize, oh my God, I just became a mom. Right? So yeah, I think that would be my story.
That's great. Was there anything from your partner's perspective afterwards that, like, was he surprised by anything, or because he sort of was on board as soon as you said you wanted to do it?
He really liked that we weren't in our own apartment for that because we do live in an apartment building. He liked the ability to be able to go outside. I remember Astrid even, like in the middle of my first birth, she went out and did yoga on that patio. I was like, how could she? I'm here alone. Yeah, he really enjoyed how homey it felt. That he felt like he was at home and he could wear whatever he wanted. He could do whatever he wanted in a way. We even had a birth photographer the second time, so we all fit in that cottage, and we had a student midwife. I think if we were to have another baby, which is not happening, I would definitely choose to do a home birth as well. And my major reason was because, like I said before, I felt safe there, and it just felt free and natural, like it should be. Like, you shouldn't. Well, it's my perspective. Like, I didn't want any interventions. I didn't want any epidurals. I didn't want anything. I think I used the TENS machine, which only helped through the beginning. And in the end, it was like, I keep pressing the button, but nothing's happening. And what I really enjoyed about the home birth is what Astrid and the student midwife were kind of down there in between my legs, receiving the child. And Natalie was by my face, telling me that I would not need to do it again. And I really needed Natalie more personally for myself than medically for like my body or the baby. So, like, yeah, I was really grateful that she was, well, you were there. Yeah.
Thank you for sharing.
Thank you for inviting me.
That's great. Thank you so much, Allie.
Anytime.
And I think Allie was our first client to ever have 2 babies in a row in our cottage at the farm.
Yeah, we didn't really prepare ourselves for the second one. It just happened, and we didn't say no. Now we have 2 kids, 1.5 years apart, and the second daughter is named Astrid.
Yeah. That's great. Thanks, Ali.
Thank you.
I think it's kid bedtime for our other guest speaker still. Send me a little message in the chat if you're here, but maybe we can go for Shay's slideshow now.
Sounds good. I just wanted to make a little disclaimer that there are going to be some real raw birthy images shown here. So if you are a little bit squeamish or you have somebody looking over your shoulder who that might not be appropriate for, who wouldn't be comfortable, now might be a good time to turn the screen off. Sometimes people ask about the families in the pictures. Everybody consents to having their pictures shown. I would never show images of anybody who hadn't consented. So just so you know that when you hire a birth photographer, that's one of the things that we chat about is if your images are shown anywhere or your birth story is shared anywhere. And if that is something that you want to keep private in your family, that's the way that it is. So all of these families are happy to share their pictures so that we can learn from them and get a better look at home birth. So I'm gonna attempt to screen share here and hopefully it all goes well. How's that looking, Natalie? Yep. So if the midwives want to unmute themselves and just add in any comments or anything while I'm going through here, usually I have a little laser pointer in person so I can point out certain things of interest. I don't have that ability to do that on this program, unfortunately. So if you see anything that you have questions about, feel free to jot a little note in the comment box or midwives unmute yourself and make a comment, or doulas if there's anything that you see. So basically, this is just a collection of images from home births that I've attended, primarily pre-COVID. So you will notice that partners aren't wearing masks, and the midwifery team is also not wearing PPE in a lot of the photos. So that will be something that's a little bit different than what your home birth may look like. Just a little bit about me. I went to school for photography. I also am a donor trained birth doula. I used to be a veterinary assistant for 2 decades, and I'm also an introvert, so I don't really like public speaking. I'm kind of on the fence if I like Zoom meetings better or less than doing this in person. I'm not sure yet. We'll see. So just a few images of what home birth will look like, and a few visual examples of the things that we've talked about tonight. A little bit about COVID precautions. So this is what PPE looks like. And I don't know if Christy wants to talk about anything here, but generally during, I think, the pushing phase, your midwife will don a cap, some goggles, the medical grade mask that we talked about, and then also this wonderful, awesome bodysuit and gloves.
Yeah, that's the whole shebang right there. And you know what you said during the pushing stage, which is kind of what it is right now, but things might change. We might wear it sooner.
Okay.
Yeah.
Yeah, so this one is one of the recent births. So just before she started pushing, midwife does have on her cap and her goggles and her mask and gloves. And then she puts on her suit when mom decides to start pushing. There's another good view. And then once baby's born. So both midwives are all gowned up there. A few pictures of setup and prep and supplies. I always like to show this picture. Having a plan for getting people into your home is great. I've arrived at a couple of births where the door is locked. and nobody is answering the knocking or the doorbell ringing or their phone. So as soon as you contact your doula or your midwives, make sure that you go and unlock your doors so that if you get into active labor and don't feel like getting off the floor, or your partner is tied up with helping care for you, that we can get in to help support you.
Yeah, and just remember, a lot of times we're coming in the middle of the night when it's dark, so make sure you put your outside light on so we can see your house number.
Good plan. This is sort of a basic setup for water birth. Pool blown up. There's a tarp underneath the pool with some towels and blankets to absorb any water from getting in and out. Over in the right-hand corner, you'll see there's a little table there with some baby blankets and then your chucks pads and all the supplies. Normally I recommend grabbing a shower curtain or a tarp to put over top of the pool just to kind of retain heat and keep the room from getting too steamy if you are not in the pool.
I just wanted to say, in terms of our setup, some midwives or their practices, I don't know if many do it in Victoria, but some of them will do a prenatal home visit for folks who are planning home birth, just to make sure, just to talk about setup and having like a flat surface like this where we can set up our equipment. So, you know, for those of you who are here who are planning a home birth, make note, like clear off a dresser for us or pull in another table, because we do need some surfaces other than the ground to set up our equipment.
I think that's also something too, if you do hire a doula. I know in my prenatal, I usually will go over that if you're planning a home birth, sort of what to have, where to have it, you know, areas that would probably be good to, you know, think about having the setup done. I don't know if Jay and the other doulas do that. I would assume so. I see Jay's nodding a little bit there.
Most definitely. Another thing too is if you're planning a pool birth, we always suggest that maybe you have 2, 3, or 4 big pots full of water on the stove boiling, because sometimes if you're not ready to get into that pool and we've already poured hot water in it, it's going to get cold by the time you're ready to get in. So it's always not a bad idea to have a couple of pots and a kettle going just to make sure that we can supply more hot water to the pool.
Yeah, agreed. This is another setup here. You can see that the midwives have arrived and unpacked their resuscitation gear, all of the suction equipment and medical stuff that they're going to need in preparation for baby coming. So having that dining room table there next to the pool, and then the couch is all set up as well in case mom decides to birth on the couch. Just another look at some of the gear that they bring and set out. So oxygen tank there, there's suction there, and then stethoscope and stuff is ready to go up on the dresser. Baby monitoring stuff, some of the drugs and clamps and stuff that will be needed after baby's born. Blood pressure cuff, stethoscope, and I think a thermometer at the back there. Sometimes people birthing will set up a mock bed on the main floor of the house so that they're not having to go up and down stairs. So just having like some blankets, sometimes a mattress laid out on the floor, just so there's maybe more space to allow for people to lay out, the midwives to lay out their gear, and you know, that you don't have to be trucking up and down the stairs. This is another quick setup. This was an unplanned home birth for this family. This was a first-time mom who was laboring at home, lovely, and her midwife came to check and found that she had a baby that was coming out. And so they had all the gear there. This was Lauren actually from Roundhouse, and she had all of her gear with her in the car and was able to get everything all set up. And this amazing mom had her baby at home and in their bedroom. Things to think about when you're laboring at home, who you want there, where you're going to be, and all of those details. So setting up, we talked about oxytocin earlier and where you feel safe. And part of oxytocin is also feeling calm and comfortable and feeling surrounded by things that you love and things that make you feel good. So, you know, setting up a little area, some ambiance, dim lighting is really nice. And looking at your family photos here and having your partner, bathtub, being close. Snacks, dim lighting, pool setup, if that's the way you want to go to. Lots of people labor on the toilet, that you will either love it or hate it. Sometimes it's a great place if we want to help you relax and get baby moving down and get into a good position. And you can be sitting forward facing, and sometimes your doula may set you up backward facing on the toilet as well. That can sometimes relieve pressure if you're feeling some pressure in your back. And it's a great place to labor because if your waters are broken and you're leaking fluid, you just go to the bathroom as needed, and everything's taken care of there. Outside laboring, some people feel really good out in nature, fresh air. You know, in early labor, sometimes people like to go for walks and get outside. Sometimes your doula may ask you to do the stairs if we want to get your hips open and help relieve some pressure or get baby working down. Having a partner, somebody that you are close with who can support you. There's also a birth ball that this mom is sitting on. Some people choose to have their children at their birth, and that also is the oxytocin factor as well, having little people that you love. And pets. Having a plan for your pets is a good idea. If you have somebody who can be a pet sitter for your dog or your cats, or locking them away. I don't recommend letting your cat onto the birth pool. But pets can be a really good comfort in labor as well. Any cultural practices that you like can be done at home and followed at home. Doulas will often help with that as well if you are wanting to have any cultural practices. And they can serve you food in labor. And your care team can be as hands-on or off as you need them to be. Here, midwife is sitting in the room next door while mom is laboring on the toilet, just needing some space and relaxing on her own. So really close in case they're needed, but not necessarily watching you all the time. And same here. This is monitoring baby while in the birth pool.
So just back to that picture, just an example, like the midwife has a glove on, but it's under the water. So her glove is getting filled with water. So that's something that we're trying to avoid right now.
Talked about having IV lines available for emergency situations, but also for antibiotics. And this was one of those situations where there was a strep B positive client. So that's getting antibiotics. And the midwives do bring the tools necessary to break waters if you request it or if it's recommended. So that's what's happening here. This is a good example of second midwife, just having a listen, jotting down notes, and helping the first midwife at a home birth. And you can plan to labor in water on your bed, and then sometimes people just have a baby in the hallway of their bedroom. Comfort measures and tools. This is a picture of a TENS machine and a birth pool. So that is electrodes that you can rent. Vita rents them out. There's also a couple of midwifery practices that do as well. I think Mothering Touch does. These are just electrode pads that you place on your back. Your doula can help you with that, or your partner. There's varying levels of stimulation that can happen that help control pain. And that's the little attachment that you use, your little controller thing that goes where you decide how strong you want it and when to sort of have little bursts of electroshock. This is a doula applying counter pressure. That's a great form of pain relief and support. This is a photo of sterile water injections that can be given by your midwife. And that is a form of pain relief. I've seen it mostly given during if mom's having back labor. I don't know if there's other situations that you would do that, but.
So you can give it just during labor.
Labor, okay.
Yeah.
Acupressure, more counter pressure by a partner. Some of the different positions, birth ball on the bed is great. And then meeting your baby at home. So this is a water birth. And you can see again here, like Christy was talking about, how the midwife is up to her elbows in birth water with just tiny little gloves on.
I just want to mention there, because it's something that's often kind of shocking, particularly to the partner who's at the birth, is the color of the baby. This is pretty normal that baby looks kind of purpley here because it was just born. And so this is something that we look out for, is how quickly they pink up, and generally in the first 5 minutes, they're looking pretty darn good.
This is a good photo of oxytocin injection being done there in the corner there, and also the amount of fluid that can sometimes come out once baby comes out. So we've got all those chucks pads underneath there to catch any extra fluid that comes out.
I love this picture. It's such an action, like that fluid, it looks like it's in motion. It's just, yeah, that's so great.
Shay, can you go back?
Yep.
Can we talk about that baby's head?
Yes.
Oh, one more.
This one?
Yeah, that one.
Yes. Yeah.
It's amazing. And I like to pause at this photo because it's just remarkable how the baby will shape to fit out of the pelvis and come out successfully. Yeah, what a great photo.
Yeah, classic cone head. An hour later,
yeah,
you didn't even notice it. Yeah.
And there's a better one of it.
Oh yeah.
That's the same baby.
That's a nice sized baby right there.
Yeah, that's a 10-pound, 4-ounce baby born at home. This is a very vernixy baby. Cord cutting. And newborn exam done. Are you guys using the fabric slings for weighing?
I think some of us still are, because not all of us have the electronic ones. Well, COVID and pre-COVID, we just have a whole heck of a lot of them, so we can wash them and they're clean. Yeah, it's a mixed bag, I think, in terms of the whole community.
Newborn exams can be done on mom. Baby's first poop can be super messy, so it's good to have some olive oil, coconut oil on hand before this happens. Meconium tends to be quite sticky. And this is just an exam after baby's arrived to check the perineum. You'll see your midwife will often look like they've got a little spelunking light on. And postpartum body. And breast crawl. And breastfeeding. And then placenta at home, same thing as in the hospital, and just coming up with a plan before what you would like to do with your placenta after it's delivered.
So just, can you go back there a sec?
Yeah.
So often in our appointments, we hear about concern of pulling on the cord to deliver the placenta. So this is actually what's kind of happening in this picture, but we're not pulling or yanking or anything on it. It's just gentle guidance that happens. And you know, we do it often with you pushing at the same time. But you know, when you're in clinic with your care provider, your midwife, we'll talk more about the third stage and your options in terms of us helping you out with it, or if you wanted to do it all on your own without intervention.
And then oftentimes, if you're interested, your midwife will do a little placenta tour for you, so you can see where your baby lived and grew, and the different parts of your placenta and how it all kind of figured out. And then you get to relax in your bed at home. So siblings meeting, cuddles with your partner, postpartum meal. And that is all.
Lovely.
Okay, well, I'm going to go ahead and ask Megan to turn your camera on, and if your partner's with you as well, and unmute and go ahead and share your birth story with us.
Okay, can you hear us?
Hello.
Hi.
Hello, bonjour.
Hello again.
I'm Megan.
I'm Eric.
And we had Felix at home on March 16th of 2019. And Natalie, do you want us to just like tell our birth story and then answer the questions that you sent us, or
Yeah,
do you want us
so
to?
we're kind of interested in why you chose a home birth in the first place for your first baby, and from Eric, like what your perspective was on the whole thing.
Okay,
that would
so
be helpful.
In terms of choosing a home birth, I never considered anything else. I was, I don't know, I just was never really comfortable at a hospital. I've never been to a hospital other than for one outpatient experience. And it was just something that I really wanted to do. When we talked about it, Eric, kind of what was your perspective?
For me, it was important that Megan felt the most comfortable as possible to avoid any stress. And for her, it was to be at home. So I felt that was important that this happened for her and for us to get the best birth experience possible, less stress, everything smooth. And I have total trust in the midwives, in delivering birth at home for us, trained professional. They would not do anything at risk at home. I don't think so anyway. And so for Megan, and I had no problem with it.
Yeah, so he just went along with what I wanted to do. And it was a really beautiful experience, fairly short. I think that surprised us. We like had a puzzle ready to go and a movie and all sorts of things. And we didn't do any of that. It was like 5 or 6 hours or something like that. So I guess the length of time was a surprise for me. And other than that, I think that it just kind of went the way that it went. I hit my zone, and that was it. What about for you? What was your experience?
It was good to be home. I remember when Megan's water broke. I was talking with my cousin. He's like, "What are you doing? Go to the hospital." I was like, "Man, I'm just the doctor come to my house. Relax, you know, everything is fine." And at early labor, we went to sleep. We thought we could sleep it off. And Megan, I was asleep dreaming that Megan was peaceful beside me. And then eventually I heard my name and I was like, oh, okay. And I didn't know she had been starting early labor by herself. We called the doula. We had a doula, Sadie.
We were really glad to have her. She was amazing.
Yeah, it was amazing. And I think I participate a lot in Homebirth, and it's not something I don't think I could have done at the hospital. Megan would hold herself on me and I would massage her back.
And when it came to pushing, he was a chair for me, which I guess I also didn't really expect. I didn't know how that would go. And like it was basically just the two of us while Natalie waited in front of us until she suggested a different position. So it really felt like the two of us birthing our child.
Yeah. Kristen arrived just at the at the right moment. Like 5 minutes later, she would have been late. Also, I saw Jay was part of the conference tonight, and so we had like a private class with her, and it's amazing. She gave us so much knowledge and experience, and she was acting how it would be. So I kind of had a lot of like kind of witness through her teaching, and it was very good for us, for me anyway.
That's true. Yeah, she talked about the body shaking at some point with adrenaline. And when I was laboring by myself, my legs were really shaky and that could have freaked me out. But instead, I was like, oh, this is adrenaline, Megan. This is okay. And that.
Well done.
Nice
to see you guys again.
Yeah, you too. Were there any other questions, Natalie?
I think just it's really helpful to have Eric's perspective. And was there, I don't know that there was anything at your birth that like maybe went a little, was scary for you, or like, I don't know that we had to pull out any of our extra equipment. You had a very big baby.
Mm-hmm. Yes. Yeah. 9 pounds and I'm 5'1" and never measured anything abnormal. Yeah. Yeah, you were surprised, Natalie.
Good for you.
I cannot during the birth itself, I cannot remember anything that didn't go well. And I also remember the aftercare of the midwife. It was amazing. Like the first few weeks where you're like a little bit kind of like overwhelmed by emotion and you energy deprived and this new being in your relationship, in your life, and then the midwife comes and it's like angel from the sky. It's so welcome, you know. It's like, oh great, it's a relief, you know. And I don't think we would have that at the hospital. I think we would have a number. Actually, you know, it's part of like we had to go at the hospital, right, to make a tour just in case something happened. And I remember it was like for us the worst thing that could have happened is we end up at the hospital. Like we didn't you know, it's like yellow and it smells funny and there's noise you don't like. There's so much thing you cannot control. When you're in the environment, it's your house, you know what's going on. Like Megan, she didn't like lights. Like when and then we have salt lamp at home, and I pulled those out. It's perfect type of light, and it was helping the midwife to do the work as well, so that I wouldn't have been at the hospital. Nobody gonna dim the light for you. I don't. Yeah, you know, your house, your rules. Well, baby rules, you know. Yeah.
Yeah, and it went really well, and it's, you know, it's always nice to hear those positive stories, and especially for somebody having their first baby. I think like one of the things that we hear a lot is, oh, I'll have a home birth but not for my first, or I'd really love a home birth but my partner would never. And so I think it's really valuable to share these stories of people who've been feeling well supported and felt like they could do it at home with even with their first, and to hear that it went well.
Yeah, all of those things. I'm really glad that Eric supported me, because I do know people that partners were really nervous, scared about something going wrong and all of that. And I was glad that the hospital is super close. So it did it, you know, if something happened, that's okay. It's not that far away.
Yeah.
And for sure, like if the pain had gotten really unmanageable, then that there is that option there. But for us, like comfort, our way as much as we could was trumped all of that. Yeah.
Yeah. That's amazing. Thank you for coming, even though it interfered with kid bedtime.
Yeah.
We managed.
Yeah.
Yep, we managed.
Yeah. So great. Does anybody have any questions for these two? We're getting some congrats in the chat. Jessica, I know Jessica, she's saying she had her first at home and treasured the whole experience. Mallory says, thank you for sharing. Jay says, it's great to see you too. Congrats.
Awesome. Yeah.
Thank you.
It's really lovely to kind of revisit it.
Yeah.
And like seeing some of those photos felt very special.
Yeah. That's a great picture.
Yeah.
Glad we could share. It was
yes, thank you so much. I'm going to turn it over to Jess Duncan now. Jess, are you here? She's here. Hello. Hi.
Can you hear me?
Yes.
Hello. Yeah, so I'm Jess. I had my son almost a year ago. Actually, his be the 17th, which is honestly mind-blowing. So I had a cottage birth at Roundhouse, and I basically knew before I got pregnant that I wanted to have a pool birth. So whether that was at home or, I mean, at the time I didn't know such things as the cottage existed, but I knew that I really, really wanted to, have a pool birth. So that wasn't going to be an option in Victoria in the hospital. My partner is pretty supportive of most decisions that I make. So once we kind of talked about that I wanted to do a pool birth, at the time we were living underneath my dad and his wife. So I didn't fully feel like that was the environment that I felt. As much as I felt comfortable at home, I didn't feel necessarily comfortable giving birth below my dad at the time. And I just didn't want to have to worry about, screaming or any of those type of things. I just wanted to be able to fully be myself without worrying about anyone else. So we were with Natalie and Lauren, and thankfully they had the cottage as an option last year. And so at that time I was in group care, and we got to see the cottage, and I kind of just, as you can see, I live in a log house. So I just knew right away that that was the type of environment that I wanted. It felt really cozy and safe and warm. And a big thing for me was that I wanted to really be able to create my environment with music and lights. And I'm a very quiet and calm person, so I wanted my environment to look that way as much as I could. And my partner's also the same. We're both just very easygoing people, and we wanted to bring our son into the world in a very quiet, calm way. And I think one thing that we really acknowledged was that we were going to do that no matter what happened. So if we ended up at the hospital, we would still bring him in the same way, but we were going to try to have a home birth for our first. So that was definitely a big decision for us, not knowing what it was like to have a baby. And I was definitely nervous and scared, and I had a lot of emotions not ever having a baby before. And most of the people that I know had hospital births, so I kind of felt like I was the one person that was choosing something different. So yeah, my partner was really supportive of my decision. And I think for him, like, he said that when I think back to my birth, I just kind of remember everything like everyone was there, but I was in my own world. So I'm not really sure what happened for everyone else, but everyone really supported me in my birth. And my partner just really was like, I think it was good for us to be in that type of environment where he could just kind of like support me the best that he could. And I had my doula there and also my acupuncturist. And so my whole team was, and I think that was another thing I really wanted my team there. So afterwards, I know my partner said that I mean, obviously we didn't have anything else to compare to, but he said that being at the cottage was really peaceful, and that he couldn't imagine us doing our birth any other way. He felt that it was really nice to have like the big bed so that we could both like lay together afterwards. So like, of course you'd have your bed at home, but we really appreciated just being able to like lay in the bed together after and have our son next to us in the bassinet. And yeah, it felt like I know not at home, but felt like home to us. And it was just really comfortable and safe and quiet. And that's just when we envisioned our birth, that's what we really wanted. I think it was challenging at times to get through that. I mean, I don't know if you remember, Natalie, but I had absolutely terrible back labor. But
didn't we shift change too during your birth?
Yeah, you were there. You were there till 8, and then Lauren came.
Yeah.
And I had the water injection, which I want to say that was the worst part.
Yeah, they don't feel great.
No. So yeah, Lauren was there when my son was born. And actually, I think weirdly enough, like from what I remember, one of the things that was really helpful that you said to me, Natalie, was it was right near the end. I was in active labor, and about like 15 minutes later, my son was born. And you said you were about to leave, and you're like, "You can get through this, Jess. Like, I'm gonna see you in 2 days at your house with your baby. Like, you'll have your baby, and like, I'll see you then." And for some reason, that like really helped me, because I was like visualizing, like, okay, when I see Natalie next, I'll have that baby.
This will end.
I won't be in pain anymore.
Mm-hmm.
But yeah, so it was challenging to have a home birth at certain times, but I think in the end, I just look back at my birth as one of the most empowering and magical experiences of my entire life. And I think if people are able to have a home birth, that it's worth giving it a shot. And what's the other question you had for me?
Maybe if anything went differently than you expected, or
I'm just mother rambling now.
Yeah.
Not really anything surprised me. I think in the end I was surprised of myself, because I was really nervous, and I was really scared, and I was really unsure of how I would cope and how I would get through it. And I think in the end I just really surprised myself that I could endure what I did, and that I did it. So it's like all the people that come before you say, like, you'll get through it, you'll make it through it, like, so I think that's what surprised me, is I surprised myself.
Yes.
And there was a point where I was like, is it too late to go to the hospital? Like and it was definitely too late. So
usually it is at that point.
Yeah, it was definitely too late, but I just needed to know. So
yep.
Yeah,
often at that point we'll just say to you, like, do you want to get in the car?
And that was exactly it.
No.
You're like, do you want to get, and I was like, no, I definitely, with the back layer I'm having, cannot get back in the car. So I'll just suffer it out.
Yeah.
But yeah, I think like I said before, my partner's experience was really positive. He just was like behind me 100% of whatever I wanted, because at the end of the day it was me birthing the baby, so he was just 100% behind me. And in the end he said it was just like a really peaceful and positive experience for him. So we would definitely do a home birth again.
Well, you know where to find us.
Yeah.
Thank you so much. If anybody has any questions before Jess signs off, just pop them in the chat there, or unmute yourself. Right.
The question is about having a home birth while living in a condo. Curious about the noise and if it's generally accepted. Well, Christy, you and I had a home birth in a condo downtown. Yeah, I mean, I think maybe some of the older condos have thinner walls, but I mean, generally it's something that people do kind of come up with. I know that there was like a little sort of tip floating around about like going around to your neighbors with like a little note and some earplugs and being like, hey, PS. But perhaps you're not that keen to actually like out yourself to your neighbors that you're like having. But yeah, I mean, I didn't find it. I didn't find that it was like problematic, like at all. Baby in a condo, no.
Before I was a midwife, my neighbor, we lived in a what do you call it? Like two houses.
Townhouse.
Duplex. And I could hear her, laboring. And it was just like, of course, I thought it was super exciting, but I think most people would feel that way. Often we're kind of nervous. Oh, people are going to hear me, but it's not necessarily a terrible thing, right? And for the most part, people think that they'll be howling and whatnot, and that's not often the case, but you do want to feel free to be able to make loud noises if you can. But again, just stepping back to where you feel safest. If that's a huge concern for you and you've got those thin walls and you think it's really going to hold you back, well, then let's think of another plan.
Yeah, absolutely.
Yeah, and I think that's sometimes part of the reason people choose to rent the birth cottage from us, is that it's at the back of our property and you can scream away. I know Jay's been teaching prenatal classes while somebody's been in labor, and
Well, that's a great teaching opportunity.
I've been the doula who's had to, many times actually, not just one time, who's been instructed by the mom, the birther, to knock on the neighbor's door to tell them to be quiet. Which which you don't think would happen, but it does when somebody's in their labor land and there's something that's really turning them off or really is getting in the way, they're gonna tell you.
Yeah.
Stop chewing, stop breathing, stop whatever that vacuuming noise is. It needs to stop right now. And I've been to a lot of births, and I have never had anybody have an experience of having an upset neighbor, or anybody who hasn't been just like really excited to then see you with a baby the next day, or for those who end up transferring to the hospital, like coming home with their baby. You don't have to tell them what your plans are, but you're going to go into labor at home likely, and just they don't have to know that you're just not leaving.
Yeah, I can echo that. I've never had a complaint or anybody come knocking during the birth, anywhere.
There's a few other questions. One is just around clarification about like COVID rules. So around number of support people at a home birth. We, as a department, decided that we would mimic the rules in the hospital. So the hospital allows 2 support people. So it doesn't designate like must be a doula, must be a certified doula. Like it could be like your partner and your mom, or it could be like your 2 best friends. Like it could be like anyone that you designate as your 2 support people. And so that goes for home. So it would be, midwives don't count in that number, but it would be like your partner and your doula, or your partner and your birth photographer, or your partner and your mom, like whatever. And then there was a question about whether there was any additional supplies as far as COVID is concerned that we would recommend having like on hand for the birth. Birth is birth. I often say, like, even speaking to hospital birth, that COVID really hasn't, birth is still birth, and COVID hasn't seemed like this big ugly looming presence in the room. I can really say that with honesty. Like there's a bit more garb, but like the love and the tenderness and the presence and the care and the support for you is still the same, and birth is still the same. And so but as far as physical supplies, you don't need anything different. We do supply a home birth kit, like at least at Roundhouse we do. So at 36 weeks, we send you home with a kit. And I might just I can just put in the chat, like what's in that kit. Some of it's actually medical supplies for us that we can like have on hand so that the IV fluids aren't like freezing cold in our car when we bring them in, or, some of it is for us, not for you necessarily, but some of it is like, oh yeah, garbage bags and bags for the placenta and stuff. So I'll put that in the chat feed.
The only other thing I would mention about like, has the supplies thing changed? Not really. We'll bring the PPE, but we do ask a bit more of families in terms of prep for the home, like because we're coming into your home and now that's our workplace for the day / night / day again. We don't know how long we're going to be there. We ask that like surfaces are wiped down, doorknobs, like that kind of thing, just being really mindful that we're coming into your bubble and it's now our workspace. So trying to keep it as safe for us in terms of exposures, and self-isolating as much as you can in the weeks leading up to your home birth so that we are feeling like it's a safe workspace environment for us. And not everybody has the means to have a second bathroom, but if there is a second bathroom, then the midwives can use that one. So things we're now requesting to modify that we wouldn't necessarily have in the past. Those conversations are happening. If there's a ton of family around and your family aren't quarantining, like that may not be a safe space for us to come in and work. And so we are having conversations with people about like making their home a safe space for us to enter, to work for an unknown number of hours. So those are conversations you can have with your care provider, but that has changed a little bit since COVID stuff. Thanks for posting that supplies list, Heidi. So that's an example of what we would give out in advance so that that's already at home.
Yeah, and a few more questions. So there was one about like mattress protection. So that's key for sure. So usually what we tell people is like put like a good sheet, like put like a normal sheet on your mattress, and then cover it with like a decently you don't have to spend a fortune, but a decent sort of plastic mattress protector. Some folks have gone and bought like really cheap like paint sheets, but they like tear and rip. And so you just want to make sure that it's not like a plastic sheet that's going to just like fall apart and not do its job. But you can totally get like painter's drop sheets, like a few of them, and just make sure that your mattress is super protective. And then on top of that, an older sheet that you don't care, maybe not white, but and then another one over top. So that's usually the standard way of protecting. I know that Shay in her photos mentioned, like if you are having, like if you're planning to use the water a lot, sometimes having like a space near, like especially in this time of COVID, if your tub is like on the main floor, you want to maybe also think about like protecting your couch as well, in case things like move quickly and you like need to move out of the tub quickly and need a space that's like protected. That's a good idea as well. There was questions about kiddos in labor. I would say the question about how do I know when my mom should come pick up my toddler? I mean, usually once your contractions are, coming regular enough, but often, I mean, I think that the main thing is that if you think that you'll be distracted by your kiddo in labor, even if it's an early labor, and you'll feel the need to kind of like tend to your kid, that's probably a good time to call and have them cared for by someone else, so that you can like totally focus in on yourself and do the important work that you are being called to do in that moment. Generally speaking, kids don't count as like the number of support people. I think that our stance around having kids, like I think we respect that some people want their kids present to witness the birth, but generally the thought has been, if you have someone designated to provide childcare while in the home, that they should actually, that designated childcare support person, who's not really your support person, it's for your kids, and your kids should ideally be in another part of the house, and that they can definitely be invited to witness the birth, like at the time of the birth, but that as far as exposure is concerned, if you've got like 3 kiddos and their care provider, that those people aren't maybe in the common birther's space for the majority of the labor. I think that's kind of what we have sort of settled on as a department. Is that clear?
And then, I mean, we wouldn't want to speak for other midwifery practices across Canada, or, like if anybody's logged in from elsewhere, but certainly the Department of Midwives in Victoria has tried to come up with some concise guidelines of how we all will proceed in the event that, one of your midwives isn't available, COVID or otherwise, and another midwife from town has to come and attend you. Then we're all practicing in a similar way. As a group, you can be sure that you'll be in good hands. Mm-hmm.
I sometimes usually like to suggest that if you are having a pool birth, to have a lot of towels, because I do find that sometimes we go to a birth and sometimes they're like, oh, we just have these 5 towels and that's it. But sometimes the birth giver is getting in and out of the pool sometimes a couple of times, and so those towels are going to be wet. And if the baby is born, well, obviously not with COVID, the babies may not be born in the pool, but sometimes we cover the baby up and then you're getting out of the pool and we don't want this wet towel over the baby. So I always suggest to go to your local thrift shop and buy a few towels, especially if you're planning a water birth, for sure, or at least laboring in the water.
Yeah, that's great. And I was going to say about preparing like a spot near the bed is often, once the baby's born, you get out of the pool and to birth the placenta, and it's helpful if there's a space nearby, because the baby's still connected to the inside of your body. So yeah. Yeah, so Heidi has put links. We had quite a bit of a chat going. They're way up at the top, but we did put together links for resources for out-of-hospital birth. And Obviously, if you have more specific clinical questions, we'd encourage you to talk to your care provider, whether it's us or anyone else in town. But yeah, we hope that this was informative and helpful and food for thought if you are interested in out-of-hospital birth. And I think we'll close there. So thanks everybody for participating. Have a wonderful evening.
Thanks for coming.
Thank you.
Thanks for coming.
Thanks, Natalie.
Thank you so much. It was
Thank you, doulas. Thank you.
Thank you, Vita and Shay.
Thank you.